Dr. Tom has been voted by you Best Cosmetic Surgeon for 9 years, and his team has won Best Aesthetician for 3 of the last 4 years by Press Democrat readers. Dr. Tom and Karina Lozano, surgical liaison, are here, and they're answering your questions today, common questions about breast augmentation. Hi, Dr. Tom.
Hi, Michelle. How are you?
I'm doing great.
Good. Hi, Karina.
Hi, everyone.
Hi. So we heard that you hosted the Grafting Apple Fair.
I did on Sunday. I had such a great time. Lots of great music and all kinds of Apple activities.
It was a lot of fun. I went there, and I was looking for, you know what, it was great, though.
hiding.
Great crowd, and it was a lot of fun. It was fun to see that. So
Yeah.
great. Hey, so Michelle, you're right. We're going to talk about frequently asked questions, and for those, I don't think I'm going to have to introduce Karina much more because she's on the show all the time with us. But for those who don't know, Karina is our surgical assistant, surgical tech, as well as our surgical liaison. So, Karina, hi.
Hi.
Hi. So,
Thank
Karina, a lot of what you do is you're taking a lot of phone calls, and
Right.
people are inquiring if they have a question about any kind of surgery that we do, or their interest. And so you are awesome because you're on the phone talking to them. What are, let's talk about just breast augmentation
Yes,
itself,
yes.
because there's a lot of questions, a lot of myths. Let's review some of the questions. So, I know you get emails and you talk to them personally. What are some of the questions that are frequently asked?
Well, I have a handy dandy list.
You
Let's
have a
look at my
handy-dandy
list.
Handy-dandy list, okay.
No, we get all the questions. They're all good questions. There's never a dumb question. There's always good questions. So one of the biggest ones is, how do I know if I need a lift or an augmentation?
That's actually it's a great question, and we hear it all the
Yes.
time, don't we?
Yes.
And in fact, in my mind, it's a question that I'm asking when I evaluate our patients. So we do consultations in office, in person, and we also do them virtually. And that's just really since
Great.
COVID that we started to do that. And patients seem to like that because it's a little more convenient for them.
Right.
They can be at work, they can be at home,
car.
In the car. They're in
That's
the
where I
car.
was for mine.
Is that you
I
were
was
for
in my
your
car
you were in
on my
your
lunch
car
break.
during lunch break? Sometimes it's in the supply room at wherever the person's working. But so we are, we make ourselves readily available to answer your questions. And one of the things that I'm thinking about when a woman is interested in being enhanced cosmetically, their breasts, is, would they be just a great candidate for having just
Right.
breast augmentation with implants, or would they need a lift? And so there is a simple kind of formula if you want to just look at it yourself, okay? And if you're driving, don't do this while you're driving. I always say that, especially this. But if you were to look in front of a mirror for the ladies and look just from the waist up, and with your arms down at your side, and that's important, not your arms up in the air, but your arms down at the side, you want to look at your breast as a sphere, okay? And what you do is you're going to look at your areola, okay, the nipple areola area, all right? And then we want to look at its position compared to the fold that is underneath the breast. So there's a crescent line that's a natural fold underneath on the underside of the breast area. And if your areola is above that line, then you absolutely do not need a lift,
Right.
okay? If your areola is below that line, hanging down, or if the nipples are kind of pointing south, okay, if they're actually pointing down, then you're probably most likely going to need a lift,
Right.
Karina, right? And so, Karina, for me, and that's where it takes, the experience, surgical experience, and kind of listening to the patient. That's really huge. We have to listen to our patients. What is it that they want? What is it they want to avoid? And for a lot of them, they want to avoid a lift. What about when that areola, the nipple, is right at the line?
Right.
And I'm going to say that for people where that areola is right at the line, probably 75, 80% of those patients would be very happy with just an augmentation. But maybe, again, 20, 30% of those patients, they wouldn't be happy because they want to have their breasts be perky, right? How many women say they don't want perky breasts?
I don't That's the rare one.
That was a negative question for you, right? Nobody says, I don't want perky breasts. They all say, I want perky breasts.
Right.
So, and for some of those patients, they wouldn't need a lift.
Right.
And so very simple, the areola, the fold underneath the breast. The technical term is inferior, meaning below, mammary, meaning the breast, fold. the IMF. So if the nipple is above the IMF, you don't need a lift. If the nipple is below or pointing downwards, you need a lift. And if you are right at that line, probably you're going to be okay with just an augmentation, but they may not be as perky as if the areola dimples were above that line. Okay, so what other kind of questions do we have?
All right, let's look at the list again. So what size? What size?
Okay.
That is the question.
That's the question. Okay, that's the $1 million question,
Yes.
right, Karina?
Yes.
And so how much time do we spend out of the several hours, probably 3 hours that we spend with the patient at different times in their preoperative evaluation? How much of that time do you think we spend on what size should I be?
1 hour is dedicated to sizing.
At least 1 hour.
Yeah.
Okay. So what we recommend, and I'm going to backtrack for a moment. So we actually did an augmentation on one of our nurses, and she was very happy with it. But her comment to me was, how do you do this? How do you make recommendations to us as patients?
Right.
Because even we, as patients, she was referring to, even we don't know what we want. So it's a tough question, and the most difficult one for a patient to come to a conclusion about. So we asked them to do the rice bag test. Okay, you're saying, so you explain it on the air. Okay, instead of having the Chinese Greek explain the rice bag test, we're going to have the Mexican explain the rice bag test.
So there's a little fun test with rice, uncooked rice. So you want to have uncooked rice.
Does it need to be Chinese or Mexican rice?
It doesn't really
Doesn't
matter.
Okay, all right.
Whatever you have at home.
So any kind of rice is good. Okay.
And also you want to have little grocery bags that you buy at
like paper or plastic?
No, you want those plastic ones that you get at the grocery store that you put your produce in.
Oh, in the produce department.
The nice thin ones.
Okay, so you're going to lift a couple of those.
Yeah, you
can.
Well, you're not borrowing because that means you're taking them back. So you're getting some.
Okay.
And then you fill it up with your rice, and you could start at 1 cup, you could start at 2. We usually tell patients, start at 1, go up, go down. We can do the mathematical. Dr. Tom does it. I don't do it. I have a cheat sheet that tells me this amount equals this. So just play with it, walk around the house, wear your sports bra, try on an outfit, kind of see how it feels. Usually it's pretty accurate for the patient. Yeah.
Okay, so to kind of just repeat what Karina says, because it can be confusing, you are going to take a very thin plastic bag like you get at the produce department, and you're going to fill it with rice.
Right.
Okay, and what's nice is that the rice conforms to the body as you fill it up with the bag and then put it in place and then put a bra on, right? And so you mentioned a cup.
Right.
So how many ounces are there in a cup?
8
ounces, right? 8 ounces, exactly. And so you can look this up on Google, but we'll just tell you that an ounce is approximately 30 ml or 30 cc. So we measure the volume for breast implants in what we call cc's, which stands for cubic centimeters, it's cubic centimeters. And so it's a volume, and it's 30 cc's. By the way, 30 cc's, which equals 30 milliliters or ml, is basically 2 tablespoons of butter. So that gives you an idea visually, okay? So an ounce is about 2 tablespoons of butter or 30 ml. So if there's 8 ounces in a cup times 30, okay, that's 240 cc's. That is in a bag of rice of 1 cup, okay? So you'll put that in the bra. A lot of times we'll say, take out the padding, and a lot of women do wear padded bras, is remove that padding, put the rice bag in place, and get 2 of them, right? Get 2 of them so you can see what it looks like. And I asked them to wear a really tight t-shirt, maybe a black t-shirt, and kind of look at yourself in the mirror, see how it fits with your body, and carry on with maybe some daily activities. It might be your new girls for the weekend, right? And you walk around with it, see how does it feel, go running, do all the activities that you might do to kind of get a sense of what it's like to be enhanced. And so it's actually, as you said, a very accurate way of doing this, right? And so 1 cup is 240 cc's, and so 2 cups, of course, would be 480 cc's. And for a lot of women, they'll say, well, what's a cup size? So I'm going to give you just sort of a guideline. It's not 100% accurate, but a cup size is about 125 cc's. So a full measuring cup, we're not talking bra cup sizes now, but a full measuring cup might enhance you a couple of may enhance you a couple of cups, bra cups, okay? One measuring cup equals a couple of bra cup sizes.
Right.
Yes, right. Michelle, you have a question for us.
I do have a question. Do you also ask while they're wearing these sort of rice bags to try clothes on or not? Like other clothes, like things maybe that they button up because that changes, right, when you change your body shape.
What do you think? What do we tell you to do?
Yeah, if you're at home, just try on a few different outfits and see how you like it.
Right.
See
I think that's a great question. And when I mentioned about the bra without padding and then a tight t-shirt, that's going to give you more of that body conformation that you might be interested in looking at. Absolutely, that's what I was saying. Go running, go shopping, go to the grocery store and return the rest of the plastic bags that you didn't left, and go ahead and do that. And that I think is really important. Be with your friends and just what you do. Hopefully, you're doing it for yourself, not for your friends. But go and socialize and see how do you feel. I think that's very important. So thank you, Michelle, for that question. So rice bag test for helping you to figure out what size you should be. What do we do then? Once they kind of come back, let's say they come back and they want, let's say 1.5 cups. They said, Dr. Tom, Karina, I want 1.5 cups, okay? So that's 360 cc's, okay? So then what do we do?
So we try on actual, well, they're not the ones that go in your body, but they're sample breast implants, and we have the silicone at the office, and we actually have the patient try them on because they're a little bit more, they're even more accurate, and the feeling and the touch. And have you tried on again? We have, we go up a size, we go down a size, we go really, really big, we go really, really small, just to get an idea of what, what it really feels like once it's on.
Right, absolutely. So you'll come in, and again, I'll ask you to bring in a tight bra that isn't padded, and maybe bring in a black t-shirt only because of just the conformational sizes, and we'll be in there. Karina initially starts, and then I come in and we help to narrow it down for the patient. And exactly what Karina said, sometimes we'll go way bigger than what the patient wanted so that they can say, oh yeah, I love these, or what are you thinking? These are way too big, okay? Then we'll go a lot smaller than what the patient wants, and they may say, oh, this is perfect, or oh, no, I want to be more enhanced if I'm going to do this procedure. So we kind of go back and forth with that. And so Karina, have you ever been to the eye doctor?
Yes, all the time.
All the time, okay. So you say, is what looks better, this one or this one? And I kind of go back and forth with the lenses, right? And then after a while, I can't tell, I don't know, whatever, what looks better, one or two. And we do that with the implants, don't we? So we'll kind of go in, oh, these are 350s. Okay, this is 375, this is 325, and we kind of go back and forth with the patient. And we spend a lot of time with them, and ultimately, most patients are super happy with the size that they picked.
Yeah, they are.
Okay,
I hope so.
I hope so. No, we don't get very many complaints.
No, we
But,
don't.
and just so you know, the listener, that breast augmentation has the highest satisfaction rate of all cosmetic procedures that we do, surgical cosmetic procedures. The satisfaction rate is 95%. Okay, so that's pretty phenomenal.
Right.
Yeah.
Yes.
What's our next question?
All right. Well, we'll stay on the sizing portion.
Okay.
We'll stay in
All
that little part of our questions. My friend got this size, whatever size, cc's, whatever cc's. They got 100, they got 250. You know, what should I get? What am I supposed to do? That kind of thing.
Okay, so yeah, my friend got 400 cc implants. Says that's what I should get, right? Right. Yeah, that's always hard because a lot of ladies use their friends as their sounding board, and that's their support group, and so they listen. Sometimes they listen to them more than they listen to us, don't they? Yeah, they do, don't they? Okay, so they're listening to their friends, and so we have to do a little bit of education with our patients and say, well, how tall is your friend compared to you? Oh, you're 5'4" and your friend's 5'11". Okay. How much do you weigh versus how much does your friend weigh? Okay. Does your friend have a muscular build? Do they have a more voluptuous build? Do they have more of a straight, thin line build, right? All these things are important. So basically, we tell our patients is listen to your friends, get good support from them, but when it comes to your sizing, you don't want to do what they tell you. You want to do what's right for you, okay, for you. And so you're going to do that by all the maneuvers that we talked about, the rice bag test, coming in and trying on some sample implants with clothes on, and we'll help you. And what your ultimate impression, your cosmetic impression, because that's what you're doing for. You're doing it for yourself. Ultimately, what you want to look at is, in terms of your size and how is it going to look, is it's going to be dependent on how big the implant is, of course, right? But how much do you start out with?
Right.
If you are just flat as can be and have no tissue, then most of the size is going to be related to the implant.
Right.
But maybe you've had babies, maybe you had a little drop, but you have a good amount of breast tissue, then it's going to look a different way, okay? So how much do you start off with? We call it your native breast tissue. In other words, not the implant, but your own tissue. And then so number one is the size of the implant. Number two is how much of your own tissue is there. And then number three is, what is your body like?
Right.
And we've already mentioned that, if you're tall and thin, are you short and thin, are you more voluptuous, all of those things play in.
Right.
And we'll go back to the one colleague that we have in the office, a nurse that we performed the procedure on, and she had it done. And many times I will use her as an example and say that here we are in a cosmetic surgery office, and all of the other staff members say, you need to go this size. And I talked her down to a smaller size, a significantly smaller size. And everybody in the office thinks she's got the largest augmentation implants, right? And because they didn't take into account her size, what is she starting with, and so forth. So there's an example right in our office of why you should do what's right for you, okay?
Right.
Get input from your friends, but you really want to do what's right for you.
Yeah.
Yes,
Can I just
Michelle.
say how much I appreciate you talking about balance and what one's own body is like, because that's so important, right? You want to look really good for what your body is, right? And
absolutely.
to be happy with that.
I truly believe in that, Michelle, and also what I have to impart upon the patient is that I want to look at this long term. A lot of times, and especially if they're younger ladies, they're kind of thinking in the moment, in the now. And I'm kind of looking at 5 years down the road, 10 years down the road, 20 years down the road, of what might be best for you. So a little bit of that comes with age and wisdom, but but ultimately we want to do what makes the patient happy. For the most part, we try to steer, if we can, guide the patient to making a decision on size that will enhance them, make them look great, but actually kind of match them. But occasionally we will, Michelle, and I think that's a little bit of yours and my own outlook, is sometimes we'll get somebody who says, I want to go bigger. I just want to go bigger. That's what I want to do. And so I have to listen to them, and as long as I feel that it's safe medically for them, then of course we will do that for them. Just as sometimes we will have somebody who doesn't want to go as big as we might recommend to them, because we think that's going to achieve their their cosmetic medical goals, and they want to go smaller. We'll do that for them as well. So, it really is patient specific. We have to customize it for the patients all the time.
It's not one size fits all.
Not one size fits all. That's right.
No, it's really tailored to you.
All right, Karina, are we still on sizing, or are we going to move on?
Well, we're going to move on from sizing. Let's talk about different implants.
Okay.
Saline versus silicone.
Right.
What's best for me? Okay,
absolutely. So what we'll do is we'll go over this during the consultation with me, and I spend my initial consultations about an hour with you, so I'll go over all those kind of decisions, and I think we're going to have to do another show, because I can already tell we got a lot of questions that are here. So basically there are two types of implants. There are the saline implants, which is a silicone shell, and then there are silicone implants, that is a silicone shell that's already filled with a gel-like silicone substance, okay, that is within it. Okay, so what is the difference, and what's best for you? Okay, so and you're going to get differing opinions, you get on different chat talk groups and all, so I'm not here to get into that conversation, but just to give you from my perspective, what are the differences between the two. So with the saline implant, it's an empty, totally deflated silicone bag, okay, and we hook it up with a little tube, a fill, F-I-L-L tube, and we roll it up like a little taquito, okay, and we slide it in through small little incision, and then we fill it up with saline or salt water, sterile salt water, and that's what saline is salt water, okay, physiologic levels of salt water. And so we fill it up with that to a certain size, and it's kind of neat when you're on the table and you're watching it, and you can see it getting bigger and bigger. The advantage of that is that you have a little bit of wiggle room with that.
Right.
So a patient might say, I'm not sure, I think I want 250s, maybe 275s, maybe 300s, and they're just unable to make that decision. We will tell them, okay, well, let's go ahead and let's get a saline implant that maybe is 250, and we can, according to the manufacturer's dimensions and recommendations, we can go from maybe 250 up to 300. So we can do that right on the table, and we can help you to determine what's the best size for you, okay, with the saline implant. We used to sit the patients up and have a mirror, but now with our technology, we basically take a photo with our iPad camera, and then patients are awake when we do our procedures, all under local, and we can show it to them, and we can show them the different sizes, and so together we make a decision. And not only do they get to participate in making their own decision about the size, Karina, but we also have 3 other ladies in the room, right? So we have Keller, who's our operating room nurse, okay? We have yourself as our surgical tech and liaison, and we also have Bridie, who's our other surgical tech and assistant. And so they will also give their input, and so you'll kind of get a group consensus as to what size you want to be. And that's a saline implant. Now, it does feel a little bit firmer when you fill it up. It's a little bit more balloon-like. With silicone, you have to decide ahead of time because it's already what we call pre-filled. They're already pre-filled. And once we make that little incision and we slide it in, okay, that's the size you're going to get. So so we don't have that kind of wiggle room for the patient, okay? So we make the determination of size and we put the implant in. The advantage of silicone and why it's the most popular, probably, what percentage do you think we put in of silicone versus saline implants?
I'd say we have maybe 70%.
70%, even higher. I would probably say 80%, I believe, of the implants that we put in are silicone. And the number one reason that we do that is that the patients feel that they feel more natural. If you kind of just have it in your hand and you're kind of squeezing it, it feels more natural. And so that's the reason that 80%, in my opinion, of our patients opt for silicone. The other thing is that with saline implants, the saltwater ones, you can sometimes on the side see some rippling on the implant. There's a little bit of rippling there. You have much less risk of that with a silicone implant. And so that's an advantage of silicone over saline. And we mentioned that it feels more natural, Karina. However, I will tell you, again, it's the yin and the yang. Because of saline and it's a little bit more balloon-like, if you will, you get a little bit more of a lift. So if you're trying to avoid a formal surgical lift, but you think, I would like my breast to be a little perkier, using saline, it's a small nuance, but it can actually lead to a little bit better lift than silicone. Yeah. Right.
I agree.
And then lastly, people are concerned about safety, and I will just tell you that in the studies that we've seen, that they're both very, very safe, and we'll go over that with you during a consultation. Too much to go over right here on KSRO, Ask the Expert, but that I would feel comfortable with my family members getting either one, okay? But if you're somebody who's just maybe really, really, really risk adverse, I would say, well, if you're that risk adverse, then you shouldn't do anything, right? Don't do the surgery. But no, I want to be augmented, Dr. Tom. But I know me. I'm anxious about these kind of things. I'll worry about it. What should I do? Then for me, it's clear. You just go with saline because and that's going to be your safer bet. Okay.
Wow. Okay. All right. Well, we have learned a lot today, but as you said, there's more questions, so we're going to have to do a part 2, right?
Part 2. Okay. We'll come back. We will do part 2. And so we do spend a lot of time. What I would recommend for those of you who may be interested, and I know it's a very personal and private decision, I want you to feel really let me backtrack. I bring Karina on here not only because she makes me look good, and
No.
okay, but I bring her on because you can tell just by the way she's speaking, she's wonderful. She's an empath. I've learned a lot from her in terms of just dealing with people, and I mean that sincerely. She is a great person to talk to. You can tell her anything. It's all confidential, and Karina can help to guide you, answer questions. She had mentioned that she was a patient of ours as well before we hired her on, and I feel very proud of her for being part of our team. That give us a call, and it's free. Just call and talk with Karina. And if she and you think that it's an appropriate way to go, then we'll ask you to send in some photos so that we can make some determinations for you. We don't want to waste your time.
Right.
And then we'll set up for a virtual consultation with me, although we do in-office consultations as well.
Yes.
And then we get the ball rolling, right?
Yeah.
We have learned so many different things today. Number one, that Karina's awesome. We learned
Aw.
Number
Thank
one,
you.
absolutely, absolutely.
But questions about an augmentation versus a lift, or do you need both? Asking also about sizing, that rice bag test, which I think is really great. Silicone versus saline, so all different kinds of questions. And really that each of these is determined by you and what works best for you and your body and what's going to make you the happiest. Dr. Tom and Karina, thank you guys for coming in.
Thank you, Michelle. It's been our pleasure.
You can visit Dr. Tom at his office. He has offices in Santa Rosa, Napa, and Maui. You can also go online and see before and after pictures. Those are great, very helpful at drtomcosmetic.com. Again, that's drtomcosmetic.com. You can also call 707-542-8340.